Hi everyone, thank you all for joining me tonight. I just want to do a sound check to make sure you can all hear me. So if you can all just type in the question box, if you can all hear me, that would be wonderful, just so we can get going. Let me just open that question box so I can see. Okay, everyone's hearing me? Okay, that's good. So I'm all loud and clear, that's very good. Everyone, Mari, everyone can hear. Hello, Tanya. Hi, Darcel. Hello, Mari. Excellent. Okay. So tonight I want to educate you on foaling. It's that time of the year already where the foals are starting to, we're starting to get a few early foalings. We've had 3 in the last fortnight. It's a little bit unseasonal at this time of the year, but anyway, it's coming up to the main part of the foaling season next month. So I thought it was a pertinent time to cover this topic. And one of the things we find the biggest problem with foalings is people interfering too quickly. So I want to run through basically the normal processes and when to panic and when not to panic. So that's basically what I want to cover tonight. So let me just click over here. Okay. So the first question we often get is, well, what do I look for? You know, my mare is due to foal. How do I know when she's going to foal? If I could answer this question, I'd be a very rich person. There's not one that every horse will give you. A lot of the signs that people look for is what we call teat waxing. So the udder gets this sort of waxing at the milk canals. So that's a sign. If your mare gets that, that's a sign that they're very close. But a lot of mares don't get that. So if you're hanging around waiting for that and it doesn't happen, it certainly doesn't mean that she's not due to foal. The other thing, just before they're about to foal, they get very restless. So sometimes they can actually look a bit colicky. So they're pacing around, they're trying to find their favourite spot and things like that. So restlessness is also a good sign that they're imminently about to foal. A lot of people look for the udder. So they say, you know, once the mare's udder gets full, if you've got a maiden mare, their udder doesn't often fill up until that foal is on the ground. So that can be a bit of a tricky one. If your mare has had 1 or 2 foals before, then sometimes that udder does fill. But again, some maiden mares, their udder will fill a month before they're due. So that udder sign really isn't, you can't rely on it. We do a test at our facility, and it's basically looking at the mare's pH of her colostrum. We have found this to be the most reliable, and when I say the most reliable, 98% of the mares that we have done this test on foal within 12 hours. And you basically go to your local pool shop and you get the little pH testers for the pools, and obviously only if your mare will let you, but if you just grab a drop or 2 of the colostrum that comes out of her teats, so you've got to get sort of underneath and milk her a bit, but you only need 1 or 2 drops on the palm of your hand. And then if you get this pH stick, and they often come with lots of other little indicators, so you just have to work out which one tests the pH, pop the little colostrum on that, and we say it goes the colour of, it goes from lemons to watermelons. So you'll be it goes watermelons to lemons. So you'll test it, you know, every day, and it'll look like watermelon, watermelon, watermelon. And then as her pH drops, which is the pH drops in relation to prostaglandin being produced, which is what the hormone is that promotes labour. So once there's prostaglandin circulating around, it drops the pH of the colostrum. And once you get to lemons, the mare's going to foal within 12 hours. So we do that on all the mares that come to our facility and foal down, and we've only had 1 mare, and she actually took 18 hours. So we tend to do that twice a day, morning and night, and that's very reliable. The other thing is you can check the colostrum, so you can get a drop of that colostrum on your hand, and we call it the tackiness test, I suppose. And if you get a drop of that on the palm of your hand, and with your finger on your other hand, if you sort of press into it, it gets really, really sticky when they're about 24 hours post-foaling. So they're the sort of the 5 most common signs that your mare's about to foal. And then the other things to be aware of is clearly maiden mares don't often give you the best signs, because they're new to the whole process and they're not 100% sure what's going on. So the hormones don't tend to read the textbook. So if you've got a maiden mare, they often don't get that udder production, or they can get it far too early. So just be careful if you've got a maiden mare. Don't rely too much on the top 3 signs. And again, being aware of your gestation time. A lot of the gestation calendars that you work on, they work on 320 days. Most mares are really about 330 days to when they foal. So 320 is great because you start checking them early. But it's it's great if you roughly know when your mare went in foal. There's nothing worse when you're going in blind. We have people buy them from sales and things like that and have no idea when they're in foal, or they've run with the stallion and they just see them getting larger and presume they're in foal and don't know when. So being aware of their gestation time is fairly important, especially with maiden mares. They're statistically a lot higher. There's a lot higher chance of them having complications when foaling. So, and the other thing I've put there is a watched pot never boils. There's nothing more frustrating than waiting for mares to foal. It seriously can become so frustrating. And it's important to know as well, with the gestation time, your mare can actually go a month to 2 months over the gestation time, and we don't panic. They're very much not like humans. Nowadays, if you go, I think it's something like 7 days post gestation, full gestation, they induce you. Where mares, we really don't do that. I think the record is 14 months gestation to have a normal healthy foal. So we clearly don't like to try and beat that record. We will induce mares once they're sort of a month to 2 months over, but there is a bit of a variance in that gestation period. We have a few clients that have mares that always go 12 months on the day. They just without fail will just have that longer gestational time. So being aware of that is good, but to not panic. We get a lot of clients ring and say, oh my God, my mare's 7 days overdue, and it's we certainly don't worry until it's at least a month overdue. So let me just so the next thing, we've gotten the signs. We think our mare is in labour, and the next important thing is to know the stages of labour. So there are 3 stages of labour. The first stage is really just the fetus, so the foal getting into position. Now when I say getting into position, they're starting to sort of come through that cervix, so they're getting their feet up and their head. The foal is actually in the position of birth 3 months beforehand. It starts to get that big that it can't move, and so if you're going to have a breech birth, you almost know that 2 to 3 months out, because the foal is in that position quite early on. And the first stage of labour can really vary from 2 hours to 2 days. So this is where your mare is restless. She's, looking a little bit colicky. She's pacing. She's, basically pissed at the world really, because she's starting to get that cramping. Any mothers in the audience can remember that, that cramping and the really uncomfortable stage. So this is stage 1, and it can be quite quick. So it can be that 2 hours and then the cervix dilates, or it can be up to 2 days. So again, a lot of variance in that stage 1. So the second stage is what we call the active labour. So this is where those contractions become very aggressive. The foal, you start to see the appearance of the foal. The waters break, and and that's basically the start of stage 2, and the end of stage 2 is when the foal is out. Now, when a mare's waters break, it's really about the same amount as a human. Like, they don't get a massive gush of water. If you don't witness it, sometimes it can just be a trickle, and it's really only, that 2 litres, 1 to 2 litres maximum, that a mare, when their waters break. So, you're sort of half thinking there's going to be this massive gush, but there's not. And this second stage of labour is the really important stage. This is, if it's not progressing quickly, there's problems. So this is the part where, it should be no more than 30 to 40 minutes. If it's longer than that, that foal is starting to get a little bit hypoxic, so it's not getting enough oxygen, or there could be complications, it's stuck. So things that prolong this this stage, the active stage, if you've got a maiden mare, often they can get tired, or they're sooky, they don't like the pain, so they won't push. Older mares don't have the, their uterus is not as muscly and as good as it used to be, so that those things can extend this stage 2 of labour. But stage 2 is the really, really important part, to be monitoring how quickly that happens. And then stage 3 of labour is the expulsion of the placenta, or the afterbirth, and this stage should really be no more than 2 to 3 hours. This time of the year, if your mare foals at midnight and the placenta's not out by 6 a.m, you don't need to call the vet. But if it's in summer and your mare foals at 10 a.m, the longer that placenta stays attached to your mare, the higher chance she can get an infection and get quite toxic. In the middle of the night, when it's cool and things are a lot quieter and calmer, you can leave those membranes in there for a little bit longer. But if it's the early morning and beginning of the day, any more than 3 hours, and you start to worry about toxicity with the mare. So stage 3 of labour is one that people sort of tend to not worry about, because they see the foal and the foal's up and nursing and quite healthy, and they just think, oh, the afterbirth will come out by itself, and they don't tend to monitor that stage. So stage 3 can be important as well. So but stage 1 has the most leniency with its time frames, that 2 hours to 2 days, where stage 2 and 3 need to be concise and quite short. So this is just the pictures of the teat waxing. Sometimes they can be really long. They can be, the wax can be almost like icicles, and 1 to 2 centimetres long. And then the picture on the right is sort of that udder getting filled and looking a little bit more developed. So, but again, the waxing, the mares that come to foal down with us are often problem mares. They've often lost a foal, or they're maidens where the owners are a bit panicky. And I would probably say maybe 20% of the mares that we've had have actually gotten this waxing. The rest have shown no signs, or they've been waxing for a few days before they foal. So it's not as reliable as people like to think. So the thing with foaling, I think statistically people need to, remember, is most mares, the majority of time, will deliver a healthy foal without any assistance and without any complications at all. So, it's one of those, they've been doing it for years, and there's no problems whatsoever. But then you've got to just remember that complicated deliveries do happen, and time is of the essence when it does happen. It's not worth sort of waiting for 2 hours to see if it's going to correct themselves. If that second stage of labour isn't happening quick enough, you need to get assistance quick smart. We always recommend the clients ring us and say, look, I think my mare's in labour, because we can be timing for them, and we can ring back in 20 minutes going, right, can you see legs? Or, talk people through over the phone, because it's just great to have that voice at the end of the phone to, to give you that assistance when you're not quite sure what's going on. So, the signs of birth, often, you know, your mare basically lays down and is groaning, and you think, okay, this is it. So and then knowing the normal positioning as well is really important, because you know, the time is of the essence. So you just really need to be able to look at it and go, yep, this is all normal at this stage. I will go through some pictures after of presentations that are abnormal, but what you should normally see is the 2 feet coming out first, and they look long and slippery and disgusting, alien type, but one should be slightly in front of the other, and then just behind that should be the nose. And we're often, you know, telling people, get your hand in there and feel, because you can have a really good idea really quickly that the foal's not coming correctly. And if you put your hand in, you know, just a normal glove on, and just pop your hand in, and people are often thinking, oh, I'm going to hurt my mare, but I can tell you she's not worried about a hand going in, because something bigger than that's going to be coming out. So just popping your hand in and just feeling those 2 front legs is brilliant. And then you should feel a nose just behind that, or just in a bit further. So if you see something sticking out, it's always great to, you know, just have a little feel and make sure everything's coming out normally. And then that's the normal presentation. The worst thing you can see is if you, you know, your mare's lifting her tail, and you can just see this the rectum, so the hole at the top, I suppose, is just sort of is poking out at you. That means that the foal's feet are actually coming, they're just coming out face up, sort of up to the sky, and this can cause a rectal tear. So, you know, if you see the mare's rectum, it shouldn't be bulging out at you. If it is, there is a malpresentation. Or if you see everything sort of bulging out at you, and your mare's pushing, she's in that active labour, but you're not seeing anything coming out, and that's within sort of 5 or 10 minutes. If you can't see anything coming out after those waters have broken, you really need to be getting on to assistance. So, and the other thing, maiden mares, or even older mares, if they don't have enough energy sources, they can become fatigued quite quickly, and you know, you sort of have to be able to jump in there and give them a hand, only if they need it. We've had a few cases where the clients have intervened and caused a bit more damage than if the mare had have done it herself. So just, you know, keeping an eye on that rear end from a distance, because the mare always lifts her tail when she's going to foal, but sort of keeping an eye out and making sure, you know, the rectum's not bulging, you're not seeing bright red stuff coming out at you. You're seeing this clear white sac coming out, which I'm pretty sure, there we go. So this is a normal presentation of a mare. So the foal is within a white sac. Now that sac, you can see there, it hasn't broken. It's got some fluid down the bottom of it there. That foal doesn't need to be able to breathe at this stage, because the umbilicus is still attached. So when you see this presentation, don't panic and think the foal's going, you know, some people go, oh my God, it's suffocating, and they get in there and rip it and pull the foal out and do all these amazing things. That foal doesn't need to breathe at this stage. It's getting enough oxygen through the umbilicus, which is how it's breathed in the uterus this whole time. So don't panic when you see that bag attached. If your mare is tired and you see that bag over the foal, it's really hard to be able to pull the foal with that sack over the foal. So if you do need to assist, it's not progressing, the foal's a bit big, you know, it's been that 10 minutes and this is all you're still seeing. If you get that clear, the white bag, and just rip it, and then you can grab a hold of those foal's legs. It's much easier than trying to grab through that, because it's really slippery and wet and disgusting. So tearing that bag is not going to hurt the foal, and it's not going to hurt the mare. But this is the perfect presentation. You're just seeing that the snout coming out, and those 2 feet, one a bit ahead of the other. And it's really important that those feet, one is in front of the other. If they're coming out exactly even, it just means the shoulders are going to get a little bit stuck in the mare. So if you are getting them coming out evenly, just grab one of the legs and just gently pull it with the mare's contraction. So they're often laying down at this stage, and so when you can see she's having a contraction, if you just grab one of the legs, if they're coming out evenly, one of the legs, and just advance it, because it just helps move those shoulders just apart a little bit so that it will come out evenly. So the biggest the part of the foaling which becomes the problem is the shoulders. Like the shoulders will often get stuck, or the pelvis. So when you see this head part, you're sort of a little bit home and hose, but you've just got to get those shoulders through, which is the next widest part of the foal. So again, if the legs are coming out evenly, just grab one and pull it a bit with the mare's contractions. So that's a brilliant presentation. That one, we love to see those. So again, these are this is a normal placenta on the left-hand side, and we like to lay it out and see the presentation to make sure it's all come out. And so on the picture on your left, the part down the bottom of the picture with the sort of the redder bit, that's where the foal has actually come out. So that's where the foal has ruptured that. And then we like to lay it out how this picture is laid out, because the two bits sort of coming off to there's a little squiggly bit in the middle, and that's the umbilicus that was attached to the foal, and then the bits either side of that are what we call the horns. And that's representing the uterus, and it's really important to have a look at the tips of those horns and make sure it's all there and all attached, because sometimes when the placenta comes out after the foal, one of those horns can actually stay in the uterus, and if you don't look at the placenta, you don't sort of realise this until about 4 days post-foaling. Your mare becomes very sick, very toxic, and if not diagnosed really quickly, can die quite quickly, because it starts to rot when it sits in the uterus. So having a look at the placenta is fantastic. And if you are getting a vet out to have a look at your foal to do a IgG test, or if there's any problems, just keeping this in a bucket is just priceless, because it's really important for us to have a look at how thick the placenta was, that umbilicus. If it's longer or thicker than it should be, then that's a good indication that the foal has gotten an infection while in the uterus and whatnot. So keeping the placenta to have a look at it is brilliant, and even taking it to your vet. Most mares foal between, now what are the statistics, between 11 p.m. and 2 a.m. is 80% of mares will foal in that time. I've noticed that most mares foal at 2 a.m. because at least at 11 p.m. you've got enough sleep, but most mares will wait till at 2 a.m. So even taking it to your vet the next day just for them to have a look at is just fantastic, because you can get a lot of information out of that placenta, just the thickness of it, the weight of it, and all of those sorts of things. So we have a few clients bring in the bucket and we have a look at it for them, and just to make sure the tips of those horns are intact is really important. The picture on the right-hand side of that browny, gungy stuff, that's actually what we call a hippotome, and that's a normal part of the birthing process, and you often don't see it because it gets sort of caught up in the pasture or the paddock or whatever. But this is it's just like a nutrient ball, and that's what the foal has sort of been excreting into the amniotic fluid, the fluid that's around the foal. And some people have found this and freaked out thinking it's some bacteria or some abnormality, but it's actually just a normal part of the foaling process, and just the fetus being in utero. So it's quite cool if you see it, and it varies in colour, but there's no if it's white or black, it doesn't mean anything at all. But yeah, they're quite interesting. So if your mare is pregnant, have a look for this when she foals, because it's quite interesting. So both of those, that placenta is normal and the hippotome there is normal. So this diagram is just running through all of the different presentations you can get. The one on the top left, this is a presentation that we have pretty good success rate in correcting and having a live foal. So as you can see, this presentation you just see a snout, you wouldn't see 2 feet coming out. So if you see a nose coming out without legs, you need to get a vet ASAP. This foal is not coming out without what we call repulsion. You've got to push that foal back and bend the legs and get them up. So the top left-hand side presentation is good. Like we can do a fair bit with that. The picture on the right-hand side, the top of the right-hand side, again, this is a great presentation. You can just, we often just sedate the mare. It's fantastic if there's a tractor or some sort of hoist available, because we can anaesthetise the mare and put her legs up, and then gravity helps us push that foal back. If there's no tractor involved available, we then normally do an epidural on these horses, so they stop those contractions. We push the foal back in, back past the pelvis, and then just get that nose up, and they come out really well. The picture below that with the ears, but again, you can see if you put your hand in and just have a little feel, you'll feel the 2 feet, but you can't feel a snout, you'll feel these little bloody ears. So having a little feel is a great idea. The one below, the foal with the bowed head, is this is a true breech. So these ones, you'll put your hand in and all you can feel is a tail. These ones are never coming out without surgery. So if you can put your hand in and you a tail, is the worst thing possible to be able to feel, because this thing's not coming out without a cesarean. So this is, and it's great to be able to diagnose this early, because if cesarean isn't an option, then you can make the decision quickly, so the mare's not suffering, because this labour goes on for a long time. So that picture on the middle right is the worst outcome possible. So the picture opposite that, so the middle on the left-hand side, these can be very, very, very tricky. And if you do pull that foal, so you see that presentation and you think, oh, my mare's tired, that's all, I'll give it a pull, you can tear the mare very, very quickly. So if you give a gentle pull and you feel there's resistance, don't keep persevering. Don't just go, oh bugger it, I'll give her a big pull, because this foal has its little hooves stuck up underneath that pelvis, and the mare will have a massive uterine tear if you force that foal out. The difference, I suppose, between cattle and horses, you can pretty much attach a vehicle or a tractor to that if it was a calf, and you'd no doubt get it out, because the cow's pelvis is angled and different to a horse's pelvis. So you'll often see pictures, or you talk to farmers and they're like, oh no, just whack some chains on it and hook it up to the ute. Unfortunately, horses just don't cope with that. So forcing this foal out will invariably kill your mare. So if you give some gentle pulls on legs and nothing's happening, don't persevere and just keep pulling or grab more people or whatever. Have a feel in there and see what's going on. The picture down from that again is another, those legs are not flexed, and again you're really going to struggle to get that foal out unless you rappel those legs back and get them flexed right up. So again, causing, pulling that one, grabbing chains onto that is never a pretty outcome. And then the picture right at the bottom on the right hand side, with that head flexed back, these are real buggers of ones to try and get that that head around. But I've had good success with them, doing good epidural and getting the mare hoisted up is fantastic if you can, but they're not too bad when the head's bent around. But again, early diagnosis is the key to all of these malpresentations. The one thing, if you've ever had a malpresentation and you've tried yourself to have a go at correcting it, is you find the mare's uterus swells so quickly it's not funny. You have about 20 minutes to correct these before the uterus starts, or the vulva starts swelling, and it can, when you first turn up, you can often get your whole hand in and around through that pelvis. Within 20 minutes, you can't even get a finger in between the mare, the foal's nose and the vulva. It's just unbelievable how quickly they swell. So any of these malpresentations, the key is if things aren't going well quickly, get the vet out there, or someone that knows what they're doing to assist and diagnose and correct quickly. So these are sort of all the presentations that you'll get. So the two on the top are great. The rest, the two below that are, yeah, horrid, and then the one on the right is good. The one on the left is not, at the bottom. So those are all of the scenarios you can have. So important time frames to consider is when your mare starts that active labour. So if you've been fortunate enough to see the waters breaking, or she's laying down and actively having contractions, and you can see when the mare starts to have active labour, you can see almost her whole abdomen just contracting in waves. So when that happens, you really want that foal out within 30 minutes. We can stretch that out to, and when I say foal out in 30 minutes, because often you've got sort of 10-15 minutes that you haven't noticed, or from when you start noticing, if that foal isn't progressing, or you're not getting, you haven't got that presentation, you need a vet out there ASAP. But if you've got normal presentation and everything's progressing okay, you only want that to be 30 minutes. If it's taking a bit longer and you're confident that your presentation's good, then you can start giving the mare a hand. But we give them 30 minutes to do it on their own. So once that active labour is over, so the foal is out, the next time frame we like is the foal to be standing within an hour. So this is to, we don't want the foal laying around. It needs to be awake and alert. It needs to have the coordination to be trying to get up. And what we like, I'm very much for lack of interference. And if any of you out there have tried, have witnessed a foaling and trying to help a foal stand, they are the most uncoordinated thing, and I find that the clients that try and intervene and help that foal stand actually prolong that process. So once that foal is out, it is what we call immunocompromised. So that foal has no immunity whatsoever, and it has to get that colostrum within the 2 hours. So the third time frame is that foal needs to be nursing, so it needs to be sucking 2 hours post-birth. And it's so important that that colostrum has been digested within that 2 hours. The longer it is from birth to the colostrum, even soil can kill a newborn. Even your normal healthy looking soil can kill a newborn foal if they don't get the colostrum, because it's, all soil has strep and all these bacteria in it, which any other horse wouldn't hurt them, but an immunocompromised foal is a ticking time bomb. So the colostrum is how the foal gets an immune system. So if that foal, a lot of people, I think we find where they go wrong is the active part of the labour is over, so the foal is on the ground and they go, job's done, I'm off to bed now, because it's normally freezing cold and it's normally about 1 a.m. in the morning. that is where the easy part, that, that active labor, yes, that's, part of the process over, but the next 2 hours is really, really important. If that foal doesn't get up and nurse, and you get up at 6 a.m. in the morning, the mare foaled at 2, you get up at 6 a.m. in the morning and that foal hasn't had colostrum, you can pretty much throw away $1,000, because you need to get colostrum into that foal. So it usually needs to have plasma. It's often spiking at temperature by then. There's just all of these massive problems that happen. So from the mare is so, so, so important, and I think that's the biggest time frame that is overlooked, is that foal is nursing 2 hours post birth. If we have a malpresentation, or if an owner is panicking and doesn't know if it's going well, and we go out to a foaling, I can tell you we don't leave that property until that foal has drunk, and it's 2 hours. Like, you're there for 2 hours. We don't intervene, because again, if you try and get a foal to the udder and start nursing, you can prolong that process, because again, if any of you have tried to do it, you can lead a horse to water, but you can't. Oh, it's so frustrating trying to get a foal to drink. You can lead them there, but they suck everywhere else but where the udder is. So I absolutely live for breeding. Breeding is my passion, but the thing does my head in is waiting for a foal to nurse. They'll suck the stifles, they'll suck the hocks, they'll suck the tail, and you're thinking, oh my God, just get the udder. So that colostrum is just so important, and yeah, we do not leave the property until that foal has nursed, because there's nothing worse than you just get home, just get into bed nice and warm, and the owners ring and go, yeah, it's not happening. It's been 3 hours. This foal hasn't nursed. Some studs milk the mare out and stomach tube the foal to make sure, and then they go off to bed, which is, that's fine, whatever they want to do. I'm very much for, it's got to be natural. The foal needs to find it. Then, the whole process of finding the udder is really important. It also, as the foal nuzzles and things like that, the mare is releasing oxytocin, which is helping her pass that afterbirth if she's still got that hanging out of her. So, if you milk the mare and just tube the foal, then, sometimes again you'll wake up in the morning and that afterbirth is still hanging out. So, it is part of the sort of natural process, and I tend to not intervene as I intervene as little as possible. So, and then then the afterbirth falls out. The one thing which unfortunately Arabs are a lot more, or they're overrepresented in this category, is if you've got a maiden mare, sometimes they will not stand still, or they've had the foal and it's on the ground, and they're sort of looking at it going, oh my God, what do I do now? What is this thing? It's an alien. It's not mine. I don't know what's going on. And they often won't stand still for the foal to nurse. So you'll see them walking around and, spinning around the foal and, wondering what's going on. And then they're getting these contractions as well, because their body's telling them that the foal needs to nurse. So they're starting to release oxytocin. So they're getting cramping, and, and then the foal goes up towards the udder, and they'll want to kick the foal, and because they blame the foal for the pains, and they sort of think the foal's hurting them. So sometimes with maiden mares, you really need to, have a halter on them and make them stand, and really, keep an eye on them that they're not going to kick the foal. We have, a few Arabs, and again, we have to sedate them to let them accept the foal, and allow that process to happen. So, really keeping an eye on this process is really important, and it's not the time to go to bed if the foal hasn't drunk, especially with maidens. They have to be monitored. And again, you'll often find if the placenta doesn't come out before the mare stands up, once the foal starts nursing, that placenta often slips out, and it's not a problem. A trick with the placenta is you can tie a knot in it, you know, and don't panic if the mare's stepping on it and all of that. It's not going to, that'll often help the situation. But tying, if it's, you know, it's been close to that 3 hours and it still hasn't come out, just grabbing it and tying a knot in it and just putting more weight. Some people have tied, you know, milk bottles with water in it, tied that to it, and just giving it a little bit of pull and allowing the mare to, you know, use a bit of gravity to get it out. The worst thing to do is to just grab it and pull it, because 9 times out of 10 it will tear. And then if it tears, we've got to go fishing for it and get the rest of it out. So if you know it's torn though, then again, you know, your mare will need to have a lavage, a flush out of the uterus, and would need to go on antibiotics to prevent her from getting toxic from any tags or any of the placenta being left in. So keeping an eye on that placenta is really important as well. And again, you know, taking it to your vet and saying, hey, check it out, can you just tell me if it's all there, is, you know, I'm sure that not many vets would be, you know, upset if you did that. So the, you know, once you've sort of decided whether the that the presentation is normal and the foal is on the ground, or I'll just take one step back. So one of the emergencies, if you come along and see your mare, is what we call a red bag presentation. So you go to the back end, you know she's in active labour, and you suddenly see this red bag coming out at you. So it's not her rectum, it's coming out of her uterus, and it's bright red and bloody looking. That is an absolute dire emergency, and you as the owner need to do something about this, because if you wait for the vet to get there, unless they happen to be on the property doing something or right next door and can be there within 5 minutes, that foal is dead. So red bag presentation is where the placenta that is attached to the mare happens with a normal the placenta stays attached to the mare, the foal pierces through it, and then you see it come through that white sac. With a red bag, the placenta detaches from the mare and comes out as a whole. So what that means, that foal is suffocating, because they need that attachment to the mare for the umbilicus to swap oxygen. So the foal breathes through its umbilical cord when it's in the mare, and most of the birthing process it's still breathing through that umbilicus. But when that detaches from the mare and you get this meaty red looking bag, I've got a picture of it in a moment, if that's presenting, that foal is suffocating in that fluid. So what you need to do as the owner is just grab that red thing and tear it open, and get that foal out as quick as possible. So I've never had a red bag and a mal presentation, if that makes sense. The foal's always coming out the right way in a red bag. I mean, I suppose it's physically possible to have a mal presentation and a red bag, but you would have hit a village of Chinamen if that's that's some serious bad luck. But normally the red bag is a normal presentation, but the mare's hormones have the signals have gotten all mixed up, and the mare has removed that, the placenta has detached from the mare. So getting that, and it is quite meaty and thick, the placenta, and you just need to grab it with whatever you can and just rip it open and get that foal out, because that foal will be very oxygen starved and what we call hypoxic. So if you see that red bag, if you've got someone there with you, get them to be ringing the vet to get them out quick smart. And these foals, if you don't get oxygen into them, they're what we call dummy foals. They're just slow. They're they take forever to drink. Sometimes they won't drink, and they die because they've had too much oxygen starvation to the brain. So if you have a red bag presentation, rip that foal out, get it out, and then get the vet there ASAP. So the rest of these emergencies after the red bag at the top are all things, now the foal is out of them. You don't have to worry about a malpresentation. The foal's out on the ground, and then these are the issues that can arise. So the first thing I've got there is FET. Now that stands for failure of passive transfer, and this is a condition where the foal has taken too long to nurse, hasn't gotten the colostrum quick enough, and has a failure of the immune system to work. So this foal is immune compromised. Even oxygen will kill it. You know, the air that it's breathing will kill it because air is not sterile. It has bacteria and things like that in it. So the only way to treat these foals is for a product called Equiplas or Plasma. And that's a picture of the product on the right-hand side. It comes frozen, and we call it liquid gold because it's about the cost of gold. So for the process of defrosting the plasma, the cost of the plasma defrosting and putting it into the foal is about $800 to $1,000. So it is an expensive process, but if they've got failure of passive transfer, that's the only way to get the antibodies into the foal quick enough to stop them from dying. So failure of passive transfer is extremely important. Another emergency with foals is diarrhea. Foals are born dehydrated, basically, and they teeter on that cliff face of dehydration for the first probably 5 to 7 days of life. So until they get their strength up, their ability to become more mobile, they are really teetering on the cliff face of dehydration. So if your foal gets diarrhea at any stage in those first 7 days, it can be severe. You know, if it lasts for any more than 6 hours, 6 to 12 hours, that foal is risking dehydration further and starting to get organ failure and things like that. So diarrhea in a young foal is extremely important to have it checked out. Another condition is what we call patent urachus, and this is where the umbilical cord fails to, when a foal is born, there's a process that happens, and the urachus, which is where the foal, which is the umbilicus, the foal, when it's in the mother, passes urine and nutrients and stuff through that umbilical cord, and when the foal is born, that should be closed off, and the foal then uses its ureter and either penis or penis or urachus to their penis or their vulva to urinate from. And if that process doesn't happen, they can still urinate through their umbilical cord, which can then cause infection into the abdomen and things like that. So a patent urachus is another foaling emergency that needs to be sorted very quickly. And then other situations are limb deformities. If the limb deformities are so severe, the foal often can't nurse. They don't want to get up and nurse as often because their legs hurt. So limb deformities can be a big problem in some foals. Again, so can colic. There's a few things that can cause colic in foals. One of the big things is meconium impaction, which is, meconium is that first poo that a foal does. Well, any newborn, human babies have a meconium feces, and it's basically all of the nutrients and waste product that has been there through the process of through fetal development. So it's that first manure to come out of their digestive system, and it's often black, thick and tarry, and it can actually be up to a metre long, 50 centimetres to a metre long of meconium. And you can imagine, because it's been in the intestines that, the whole time sort of through gestation from when it has developed, it's really thick and can become really hard and can get impacted. So it's most common in colt foals. So if you happen to have a colt, keep an eye on them for this meconium impaction, and it's really obvious if they have it, because they really, really, really strain like there's no tomorrow trying to pass it. So you'll see them, and they get really quite colicky and painful with it. And the problem with this meconium impaction is because they're in pain, they stop drinking because they're too busy concentrating on the pain. So they also get dehydrated, which causes the impaction to get worse because they're not getting enough fluids in. So it's sort of this, this nasty spiral of dehydration and further impaction. So if you don't notice that meconium passing or the foal is straining quite a lot, sort of for 6 hours post-foaling, and you see they're still straining, then they often need intervention. And then another situation that can become urgent is any sort of hernias. We had a foal that had last year that had a hernia, and so a hernia is just a problem with muscles or they don't sort of align properly. And the most common one are scrotal hernias. So intestines leave the abdomen and enter into the scrotum. You can have umbilical hernias, so where the umbilicus is, the muscles along the abdomen don't join properly, and it allows intestines to come through. We had a foal last year that had a umbilical hernia, and it was basically when it was born, and once the umbilicus sort of detached from the placenta, intestines came out. So we were lucky to be there and witness the foal being born and could rectify that pretty quickly. But so hernias are something to keep an eye out for fairly quickly. So so these were just the picture on the right is what I was describing red bag before. So it's this bright, and it looks like a velvet sort of carpet that's coming out towards you. It's bright and red, and that's a dire emergency, and that's the one you need to get a hold of and just rip it out and get that foal out really quickly. So don't waste any time if you see that presentation. The picture on the left-hand side, this is something that you need to be aware of, but it happens very, very, very uncommonly in the mare, and this is what we call a prolapse. So the foal is actually out in this situation. Mares don't prolapse. Cows can do it, but mares can't. They can't prolapse their uterus without the foal being out. So a lot of people go, oh, but hang on, what's the difference between a red bag and a prolapse uterus? If you've got a foal on the ground, you don't have a red bag because the foal is out. But if you do have a foal on the ground and you see these sort of redness, bright stuff happening, that's a prolapse, and that mare needs to be seen to extremely quickly. Amazing the difference between horses and cattle, because cattle can have their uterus hang out for a week and they can often go and foal the next year, where a horse, if it's out for about 20 minutes, it's usually euthanasia because they just don't cope with the get extremely quickly. So if you see something red looking at you, if you've got a foal on the ground, panic because it's the uterus. If you don't have a foal on the ground, panic because it's a red bag. So don't look for hope to not see red things poking out at you. So this is just a picture just to get your bearings. The mare's tail is at the top and it's being held up, and then legs either side of this picture, and this is what we call a rectovaginal fistula. And this mare she had issues foaling, and the rectum was protruding at these people, and they just cut this mare, and the rectum and vagina hang very close together, and they had to cut the foal out, so they had to cut basically they made the rectum into the vagina. So this can be a massive problem. It can be fixed, and it doesn't rule out this mare ever breeding again, but it does become a bit problematic. So this is a rectovaginal fistula. So 2 holes become 1. So again, diarrhea, foals are fantastic. Well, it's not fantastic, but it's really obvious when a foal has diarrhea because they get this windscreen wiper look on their bum because their little tail is just like a feather duster and it just collects all of the feces, and because they're swishing their tail a lot, they get this right sort of windscreen wiper look. So if a foal has had diarrhea for more than 12 hours, in summer, in the middle of the day, we say if it's been more than 6 hours and it's not slowing down, call the vet and get the vet out quickly. Because the foals, absorb most of the nutrients through their large bowel. So if the exit time is quicker, so they've got diarrhea, they're not absorbing nutrients. They do absorb a lot of water through their large bowel, so they dehydrate really quickly. So these are some limb deformities that are pretty impressive and can really prevent foals from wanting to stand up and drink. The picture on the left-hand side is what we call the crab walkers. They have these limbs that they just can't straighten. So these become really hard to get nursing. And so the picture on the left has contracted tendons, and then the picture on the right has lax tendons, and they can't stand up, and they're often walking on their fetlocks. Both of these conditions aren't life-ending, but they do need intervention very quickly. The picture on the left, this foal was left too long. I think this was actually a month old when it was seen, and by that age you really can't do anything. If this horse was given a drug when it was sort of three days old, that would have potentially been fixed, but the owners just left that a little bit too long. And the foal on the left, when they have lax tendons like that, it really only involves potentially padding those fetlocks so that they're not getting damaged, and the foal being confined to help get the strength into those tendons. But you'll be amazed how quickly they correct. And if your foal comes out like this, don't panic. Give it a good 24 hours before you call the vet, because it's amazing how quickly these foals correct themselves. And we really don't do anything in the first 24 hours because they come out so uncoordinated and useless that we give them that 24 hours to strengthen anyway. So the picture on the right-hand side, it's not a good picture because you can't really see, but the urine's actually coming out of that urachus. So if I can get my mouse here, this is the umbilicus, and there's actually liquid coming out of the umbilical cord as well as the penis. And this foal has a patent urachus, so it's urinating into its abdomen, which really isn't a good idea. So this foal needs to have surgery quite quickly because this foal was actually a few days old. One of the ways to fix this problem is when the foal is born, we recommend putting straight iodine onto that umbilical stump, and the iodine actually helps what's the word I'm after? It basically helps seal that umbilical cord to prevent that from happening. So we do recommend putting iodine. The picture on the left-hand side, you can see that this owner has put iodine on this cord. And it just prevents infection and bacteria tracking up that umbilical cord, and it helps seal it over as well. So we do that fairly quickly after birth. Once that cord has broken from off from the placenta, we recommend putting straight iodine on it. And the picture on the left here is showing an umbilical hernia. So that's actually intestines in that bulge where the umbilicus is. And depending on the size of it, they need to be corrected fairly quickly within the first sort of week of life if they're quite large. These are just some pictures. This is a giraffe with joint ill. So the failure of passive transfer, that condition I was talking about earlier where the foal doesn't get colostrum fast enough, the biggest side effect of that is joint ill. So bacteria tracks into the foal, and it normally heads to the fetlocks or stifles or hocks or one of the joints and sets up camp there, and they get quite sick and massive swollen painful joints. So this was a giraffe with joint ill, which I just thought was a bit cute. And then the picture on the left-hand side is a foal that had angular limb deformities, and that's the walker frame that they worked out for the foal, which I thought was a fantastic idea. So yeah, so they're just some sick foal pictures, or giraffe. Okay, so does anyone have any questions that they want answered? We're only going to cover foaling tonight. The next webinar that we are going to do, if it's not next month, it'll be the month after. Oh no, next month we've got a webinar on, I have a rehabilitation lady coming in to give a talk next month, so a bit excited about Kate. She has a sports rehabilitation facility, and we do a fair bit of work with her on correcting, sacroiliac problems and that sort of thing. So she'll be talking next month, and then the month after that we will be having a webinar on AI and insemination. So does anyone have any questions on foaling? And is anyone expecting this this breeding season? That's another question. So I'll just whack this across because I've got some questions there. If you think or know it's in the breech position, i.e. via scan, early on, so can you turn the foal? No, Darcel. The foal is in that position, and unfortunately the only thing you can do is induce labour, and sorry, not induce labour, you can book in for a caesarean, so it's not an emergency situation. That does decrease the price, but yeah, no, you can't move the foal around. Almost 100% of the time our mares have eaten their placenta. Oh, isn't that disgusting? Yeah. It just churns my stomach, Darcel, when they eat their placenta. And when that happens, yeah, you just, you can't you can't do anything about it because they have eaten it. But yeah, and there's some, when I'm having my children, we did a sort of not a natural birthing, but that sort of thing, and they actually offer you the placenta to drink afterwards if you'd like. Oh, I passed that up, so are there antibacterial or pain-killing properties in the afterbirth? No, it's just it is the most nutritious meal that they will have, so it has every nutrient that the horse requires. And interestingly, Darcel, the reason they eat it goes back to their fight or flight when before we were invented, and if you left a placenta laying around, the lions would come and eat. They'd know that there was a newborn, and they'd come and get the newborn. So the mares get rid of all evidence that that there was a foaling. So that's the main reason why they eat it, is to prevent the wolves or the lions coming to eat them. Tanya has had, so you don't have a foal this year. Okay, yep. Yeah, it's great fun. At the time you're probably not enjoying it, but it is amazing seeing them foaling and whatnot. Now I do have a question regarding twins and mares. If your mare is one of a twin, has she got a higher chance of producing twins herself? Interestingly, there has been not one study done on this, and I think that's probably because they don't, when you are doing breeding, you tend to remove, if there are twins, you tend to get rid of one of them. So the statistics probably aren't high enough to see whether you don't sort of follow them through once they've born, whether to see whether they have twins. So to answer that question, I couldn't answer it. I'm not 100% sure if the mare has been one of a twin, whether she has a higher chance of twins. I know that thoroughbreds are represented a lot more in that stakes, but yeah, I couldn't tell you whether there's a higher chance of them being a twinning mare or producing twins either. So I'm afraid I can't answer that question. Okay, I think that's all the questions there are. So I hope you've all gotten something out of the talk. And oh, here we go. Hang on, sorry. Any stats on colts versus fillies, perhaps for specific breeds? Tanya, this is a really I always get amusement um, from this question, because we have a lot of clients who say to me, "Oh, you know, can you breed closer to the full moon, because I'm guaranteed to get a colt." There's actually there's no rhyme or reason. There's no statistics to say that, so there's absolutely no statistics to say certain breeds have certain colts or fillies more than any other. So we've got a question here. Lee has a pregnant mare. We can see the baby moving, but by all scans, hang on. I have a question. I have a pregnant mare, but we can see the baby moving, but by all scans, she took after service on the 12th of Feb and is due on January 17th. It only showed one heartbeat. Should we be seeing so much movement this early? Should I have scanned again? Oh, okay. Yeah, look, some mares, they look pregnant from, from basically 14 days of pregnancy, and then others take forever before they look. So I wouldn't be panicking if you had a mare scan and there weren't twins, as long as they were a fairly they were au fait with equine reproduction. The chances of missing a twin, depending on how far along she was, you can be, it's very variable. So I wouldn't be panicking about movement so early on. So okay, just sorry, back to your question, Tanya, about any stats on colts versus fillies. There's no one particular breed that will throw colts and whatnot. However, in saying that, you do get mares that will only throw colts or will only throw fillies. So they just for some reason seem to only produce the one breed, the one sex. So that has been documented, but it's not, it's mare by mare, and you don't know that until they've had about 7 colts and never given you a filly. So you can actually buy semen now that is sexed. So you can buy it and it's guaranteed to give you a colt or a filly. So that's fairly interesting, but it's not cheap. So if you want what we call sexed semen, it is available for certain breeds and certain stallions, but it's mostly imported, so it comes with a bit of a price tag. Now you know all of this. Are you having any more kids? No, my breeding days are over, Darcel. Well and truly. 2's my magic number, and interestingly, for everyone out there, I planned my children. They're both born in the non-breeding season, so they don't interfere with me having to get up on cold nights to help mares have foals. So yes, we did plan them so that they weren't in the equine breeding season. But yes, no more children for me. Beautiful. Okie dokie. I think so. If I've missed any questions, I will go back through, and if I have missed any, I will reply to you privately. So once again, thanks very much for your attendance, and I will see you all next month. Thanks very much. Bye.